Welcome, Your Excellencies, Minister Ulstein, Dr. Tedros, ladies and gentlemen and colleagues. As President of the NCD Alliance and on behalf of our other co-hosts, the Norwegian Ministry of Foreign Affairs and World Health Organization, we're delighted to welcome you all to today's online event. Wherever you are in the world, we are all living through unprecedented challenges. The coronavirus pandemic is not only a threat to our health, but it has also crystallised pre-existing fault lines in our societies. Inequalities and injustices that we've lived with for far too long are ever more apparent. We might look back on 2020, the crises and social upheaval, as an opportunity that we had to affirm that we won't return to the old normal, but rather we affirm the values that must underpin our health systems and societies for the future. The COVID-19 pandemic shows that people living with non-communicable diseases are at high risk of becoming severely ill or dying from the virus. We already know that the vast majority of people who have lost their lives to COVID-19 had what the media sometimes describe as underlying conditions, and in particular NCDs. There are real people, families, communities and stories behind every one of these numbers. Today, nearly 1/4 of the global population, 1.7 billion people, are living with one or more NCDs, which put them at high risk from the virus. The collision of NCDs and COVID-19 threatens to leave a legacy of long-lasting impacts in three ways that I'd like to describe today. Firstly, as a result directly of the virus itself. Secondly, as an indirect result of disrupted or delayed care, screening, diagnosis and treatment. And thirdly, as a result of the policy responses, lockdowns, travel restrictions, distancing, increasing exposure to NCDs and mental health risk factors. The pandemic starkly exposes the link between NCDs, communicable diseases and health emergencies, and shines a light on uncomfortable truths. One being the importance of public spending on health, prevention and essential public health services, and the importance of this for all of our countries. As a result, now many countries are finding themselves unprepared to face COVID-19 because of underinvestment in these critical areas. And people living with NCDs are often the most affected, but the impact will eventually touch everyone by destabilising our health systems and our economies. We've seen the epidemic preparedness rankings like the Global Health Survey Index are turned upside down by COVID-19, and that will come as no surprise to many of us. Causes of poor health, including broken food systems, poverty, inequality, have catastrophic consequences for our health and the health of societies. Unhealthy political decision-making predates the pandemic response. It goes back not just months, but years. But COVID-19 provides an opportunity for our world leaders to chart a new direction that prioritises the health of our people and the health of our economies. We know this can be done. It can be done by action on NCDs and risk factors that cause much harm: tobacco, alcohol, unhealthy food, air pollution, physical activity have made us all more vulnerable and our nations less secure. 2020 will be the year we truly understand that emergency preparedness depends on strong health systems, a resilient, qualified, well-resourced workforce and healthy populations. Indeed, our future health security and economic security depends on finally taking action on NCDs, as well as learning the lessons for infection control. Before I hand over, one of the key lessons that is being learnt during the COVID-19 period, as with so many other global health crises, is the critical role that civil society can play in the response. Whether delivering services on the front line, raising awareness, supporting communities, providing a voice for affected communities and a voice for the most vulnerable, and gathering and presenting data and real-world evidence to inform policy decisions. To support these efforts and to protect and safeguard the sustainability of NCD civil society movement around the world, NCDA is delighted to be launching today our new Civil Society Solidarity Fund on NCDs and COVID-19. I'm really thrilled and excited by this new initiative. It is the first of its kind, a solidarity fund that is dedicated to supporting civil society in their moment of need and particularly in their response to COVID-19. With a total fund of $300,000, it will competitively award grants to 20 national and regional NCD alliances from across all regions. These grants will strengthen their organisational resilience and sustainability, support them in addressing the challenges and implications of COVID-19 as coalitions, and in advocating for public health, stronger health systems, and meeting the needs of people living with NCDs. We would particularly like to thank our wonderful NCD Alliance supporters who have made this possible, thanks to generous financial contributions, the Leona M. and Harry B. Helmsley Charitable Trust, Access Accelerated, Takeda, AstraZeneca, and Upjohn Pfizer. A strong civil society movement is essential to build back better and shape the legacy of this pandemic. The new Solidarity Fund will ensure NCD advocates can continue their much needed work around the world. I look forward to the discussion and hear what we can do all together to build back better for the 1.7 billion people living with NCDs at risk today and for today's youth and future generations. We know very well that the majority of NCDs can be prevented or treated with smart policy measures and sound investment in universal health coverage. Inaction on NCDs is another injustice and one that I know collectively we refuse to accept. I thank you all for joining us today and wish you inspiring and productive discussions. Thank you very much.